Hi there, my name is Eytan Stein. I'm the chief of the leukemia service at Memorial Sloan Kettering Cancer Center in New York City. And I'm here to talk for a minute about the future use of FLT3 inhibitors in acute myeloid leukemia. I think everyone on this video or who's watching this video likely already knows that FLT3 inhibitors are approved for patients with newly diagnosed acute myeloid leukemia in combination with chemotherapy, intensive chemotherapy. They're approved as single agents, or gilteritinib is approved as a single agent for patients with relapsed and refractory FLT3 mutant acute myeloid leukemia. And then the FLT3 inhibitor gilteritinib is also used widely, although not approved, for maintenance therapy in patients with FLT3 mutant acute myeloid leukemia who have gone on to an allogeneic stem cell transplant. So I think the future use of FLT3 inhibitors is going to be maybe in three different settings. The first setting is by combining FLT3 inhibitors with our backbone for older patients with acute myeloid leukemia, which is azacitidine and venetoclax. In patients with FLT3 mutant acute myeloid leukemia, there has been data presented and published that shows the combination of a FLT3 inhibitor, gilteritinib, or quizartinib with azacitidine and venetoclax for newly diagnosed FLT3 mutant acute myeloid leukemia leads to high rates of complete response and perhaps a survival benefit compared to historical controls. So that's one setting. I think the second setting is going to be to combine single agent FLT3 inhibitors with other targeted therapies in patients who have relapsed and refractory acute myeloid leukemia with other mutations. So an example of this is that there are some patients who have IDH mutations with FLT3 mutations. There are some patients who have NPM1 mutations with FLT3 mutations. We now have targeted therapies against IDH1 and IDH2 and targeted therapies for NPM1 and menin inhibitors. So trials and clinical activity looking at the combination of FLT3 inhibitors with IDH inhibitors, FLT3 inhibitors with menin inhibitors are also things that we're going to see down the road. And the final thing I wanted to talk about is the use of FLT3 inhibitors, perhaps in patients who don't have a FLT3 mutation. So there's a very interesting trial that was published in the Journal of Clinical Oncology looking at the use of a drug called quizartinib in combination with intensive chemotherapy for patients who are FLT3 wild type. And that trial showed an event-free survival benefit in those patients over giving intensive chemotherapy alone. There's now a large randomized phase 3 trial to explore this. But it may be that the use of FLT3 inhibitors has benefit outside of the context of having a FLT3 mutation. So I think FLT3 inhibitors are exciting. They're exciting because we're going to use them in more settings, and maybe most exciting because it's possible they'll work outside of the use in patients with FLT3 mutations. Thanks so much for your time. Have a great day.